Good morning. I'd like to welcome everyone on behalf of myself, the management team, and Ray and Christine Redicop, our owners, to Hash Breakfast Eatery and a Forno Italian restaurant. It's an honor to be able to host Premier Kenney and other members of the Alberta Legislative Assembly here in Red Deer. We opened our dual concept restaurant late in 2021 during the fifth wave. There's been challenges to overcome during these times, but we were able to continue to operate with restrictions, but also to keep our staff employed. We're looking forward to the next step of easing restrictions and to see how Alberta can begin to grow once again. Welcome the Honourable Premier Jason Kenney.
Well, thank you very much, Matt. Thanks for welcoming us here to Hash, a great new Alberta small business. I understand you guys are starting another one next door, a good example of how Alberta's economy is taking off. And now, after we have fully opened today, we are going to see a new surge of business and employment in the service industry. It's a great day for Alberta. It's a great day to be here in Red Deer. I want to thank my legislature colleague Jason Stephan for being here and to acknowledge I've been with Adriana LaGrange as last night we announced an important new investment in the Red Deer airport that is going to better serve central Albertans, just as the huge $1.8 billion investment in the renewal of the Red Deer Regional Hospital, which we announced last week. And yet another good news announcement to come later today. Thank you to my colleague, Minister of Health, Jason Copping, lots of Jasons here today, for joining me as well for today's exciting announcement. And what a day it is. After 2 years of on-again and off-again interruption to our lives, 2 years of living frequently under public health restrictions to protect our hospitals from COVID-19. After 2 years of on and off masks, of limiting our social circles, of working from home, of those plexiglass barriers, of all of it, after 2 years of kids having to bear too often the weight of a global pandemic, 2 years of extraordinary government intervention in our lives, and let's face it, 2 years of too frequently division in families and communities. After all of that, friends, we have to be honest, it has been 2 tough years. We've seen our healthcare system at times stretched to its very maximum. Alberta's healthcare heroes, many of them are physically and mentally exhausted. We honor them and we thank them from the bottom of our hearts for all that they have done through COVID-19. Our hospitals and healthcare centers have readjusted spaces to accommodate yet more patients when needed and to create more capacity in intensive care. And after all of this, after all of it, they continue to care for Albertans as like the dedicated professionals that they are. Friends, after these past 2 tough years, we have finally turned a major corner on COVID-19. All of the data, both here in Alberta and right across the world, says that the worst of COVID is behind us. And that this disease that has changed our lives in so many ways is no longer an open-ended threat to our lives and livelihoods from all that we know today. And that is why, as of midnight last night, Alberta has lifted basically all of the remaining public health restrictions that were in place. And I have to say, it was a bit odd coming in here not wearing a mask, but it was also pretty awesome. We have ended the provincial mask mandate. We have removed all capacity limits for venues. We have ended restrictions on interactive activities, on liquor service, and on operating hours for bars and restaurants, plus other hospitality venues. And let me pause to say just a huge thank you to all of the business people and the workers, especially in the hospitality sector that's been so hard hit for their forbearance, for their patience, for their care for others, for their workers and their customers. We know it's been, and I know it's been especially difficult for frontline retail and hospitality workers often to have to be at the front line of enforcement of difficult public health measures. And I just want to say to the waiters and waitresses and managers and bartenders up and down the province who've lost hours in income and had on and off a couple of really difficult years, thank you for your care and professionalism. So we've also removed all social gathering limits, we've lifted remaining school requirements, and we've ended health screening before youth activities, which was the only remaining measure applied to kids and teenagers. We've also ended the mandatory work from home order. And I think that's great news for downtown cores across Alberta, but especially the two big cities, as thousands of workers will come back to their offices starting today to breathe new life into streets that have been empty for too long. And that means such a lifeline for those downtown businesses that have been struggling on and off for the past couple of years. This is great news for so many people. But we still need to take some measures, of course, to protect the most vulnerable. These targeted measures are focused on high-risk settings. For example, you'll still need to wear a mask at hospitals and nursing homes, as well as public transit, because there may be people who have to take public transit, who may be immunocompromised, and at this stage, we just want to take care for them. Of course, there will still be those Albertans who choose to wear masks more generally, and who make choices for themselves and their families that are right for them and their level of risk. These Albertans must be respected for their choices. In a free society, people deserve to be able to make free choices, and we should respect that. However, something Albertans do not deserve right now is uncertainty and confusion. And that is why I'm announcing today that Alberta's government will introduce into the legislature as soon as possible amendments to the Municipal Government Act which will remove the ability of municipalities to impose their own separate public health restrictions. And we are doing that because we need to move forward together. There has been too much division over the COVID era in our society. We need to do everything we can to put that division behind us, to not allow these lingering issues to be a divisive political football. And we certainly shouldn't allow political science to be substitute for public health science. We can move forward safely and confidently together with clarity instead of confusion. We are concerned that a patchwork of separate policies across the province could just lead to greater division, confusion, enforcement difficulty, with no compelling public health rationale. And that's why we have decided to move forward united with a clear, consistent approach that all Albertans can easily understand and comply with. Now, we will say more about that in the days to come. But let me move on to say that the data trends continue to be encouraging. I reviewed them on Saturday in Grand Prairie when I confirmed that we would move forward to stage 2 of our Path to Normal plan for opening. We have seen a significant decline. In fact, we've gone from over 50,000 active cases at the peak of the Omicron wave in January to under 10,000 cases now. We have seen a steep decline in the average of new daily cases. We have seen weeks of decline in our wastewater data across the province, a key leading indicator. We have seen a substantial decline in the positivity rate. In fact, we peaked out, I believe, at a positivity rate of 40% at the peak of the Omicron wave, and we have now seen that positivity rate in the last few days averaging under 20%. We are seeing, most importantly, the pressure on our hospitals declining significantly and quickly, down to only 83 ICU patients with COVID, some of whom are not there for COVID. And we have gone from over 1,600 non-ICU patients with COVID to about 1,200 today. And those numbers continue to fall, reminding you that about 30% of those non-ICU patients with COVID are not being treated for COVID. They are incidental cases. And as we look around the world, we can see encouraging trends from jurisdictions that got hit by the Omicron wave much earlier than Alberta, across Europe and many U.S. states that began safely, moving in the same direction that we are able to today by lifting all or almost all of their public health measures, in some cases weeks ago. And what we see is a consistent international trend beginning in South Africa, moving to the United Kingdom, Scandinavia, continental European countries, and many U.S. states that have safely lifted measures and continued to see COVID hospitalizations and case numbers decline. In fact, we've seen that here in Alberta. because we went back to in-classroom learning in our schools, in our 2,400 schools, in early January. Some predicted that this was going to lead to massive outbreaks and an unsafe learning environment for students and an unsafe working environment for teachers. But in fact, since then, we've seen nothing but a steady decline in school outbreaks and transmission in our schools. That's also true of our decision 3 weeks ago to lift the mask mandate for kids at school and kids generally. We did that exactly 3 weeks ago, and since then, we have seen the number of schools unable to have in-classroom instruction go from 24 out of 2,400 schools to 0 schools. So to those who threatened to sue the government to force little kids to wear masks indefinitely, with respect, I hope they'll acknowledge that that we got this right in a safe and prudent way by following the data. That's exactly what we're doing here today. And so, when considering all of this information as a whole, there is nothing that could suggest that Alberta's path to normal that started on February 8th has or is negatively affecting our healthcare system. In fact, the data says the opposite. It appears that overall transmission continues to decline, with hospitalizations and those requiring ICU care. And that's just our data from here in Alberta. Around the world and across Canada, as I've said, jurisdictions are experiencing similar trends. And so I want to be clear about something, though. We will continue to monitor the data, and we are always there to ensure that we respond to any potential threats to our hospital system. But as I've said from the past history of contagious respiratory diseases, I believe that we can have a high level of confidence that with our level of population protection, with 90% of the population with first dose vaccination coverage, 87% with second dose, with a growing number of Albertans that have the additional protection of a booster shot, with the availability of pediatric vaccines for parents who want that for their kids, with new approved treatments and drugs coming on board, with the additional knowledge that we have gained, with the special care that we can take for the most vulnerable and the immunocompromised. With all of that together, it is time for us to move forward. To move forward with some optimism. You know, I keep getting questions from media. Should we not be afraid about moving forward? We cannot live forever in fear. And we are social beings. We are made to encounter one another, to see each other's faces, to smile, to embrace our family and friends, to regain the social lives that we have been so deeply impaired for the past 2 years. And that is exactly what this plan allows us to do. So let's move forward together. Let's get our lives back to normal. But we should make sure that we continue to hold on to those values that make Albertans special: respect for one another, the freedom to make our own choices, and the power and the strength of our communities. Alberta, we've been through a couple of tough years, but together we have got through the worst public health crisis in a century and the worst global economic collapse in a century too. And now it's Alberta's time. Now Alberta is on a roll. Alberta is on the rise, and we won't stop, because this is the best place in the world to live, work, and raise a family. So thank you to everyone for your patience. Thank you for your forbearance. Thank you for your care for others. Thank you for the healthcare workers. Thank you to everyone who has made some kind of sacrifice over the past 2 years. It's been a divisive time. Let's leave that division in the rear view mirror. Let's look through the windshield. Let's be hopeful and optimistic about this great province that is once again on the rise. God bless. I missed my last part of the job there, which is to introduce our great Health Minister, Jason Kenney.
Thank you, Premier. Thank you and good morning, everyone. It's great to be here at the Hash and be welcomed. And I'm looking forward to a pizza lunch after we finished here. A little bit early, but it'll be great. Today, as the Premier mentioned, we are taking another step forward. Steps towards a refresh, toward a time to reconnect with family, friends, and with loved ones. And toward to revitalizing our economy and restoring our health care system capacity. Now that over 3.3 million Albertans are protected with 2 doses of vaccine, I believe Albertans are ready to take hold of this chance to open their lives back up to normalcy. Starting today, Alberta is removing virtually all COVID-related measures. There are no limits to social gatherings, regardless if they're inside or outside. Employers can welcome their employees back into workplaces to once again collaborate face-to-face. The last of requirements in schools are now lifted, and mandatory health screenings for children and youth before activities have also come to an end. And venues and businesses of all sizes are now allowed to host to their full capacities and without restrictions on interactive activities, liquor service, and operating hours, including pool tables. I haven't seen any pool tables here yet, but maybe that's coming. Finally, the broad provincial mandatory mask mandate for indoor public spaces has now been lifted. That being said, we are maintaining masking requirements for AHS facilities, continuing care, and public transit up to Step 3. And although it is no longer mandatory, masking is still likely to continue in community health settings such as physician offices, pharmacies, and physiotherapist clinics. This is critical for protecting those in our most high-risk settings. I'd also like to remind Albertans that this is a time of transition. Some of us are ready to be out in the public without masks, but others may need a bit more time or may have personal health reasons for additional protection. It is important that we are respectful of the choices that individuals make based on their personal context. We have been through a great deal the last 2 years, and it is understandable that there are a variety of feelings right now. Both excitement and uncertainty are valid. So I'd like to be clear that we are not undertaking this lifting of restrictions without considering all solid evidence. As mentioned by the Premier, the numbers are encouraging and they're coming down, and this is why our plan is based on these numbers. So while the latest data will be posted online when it becomes available later today, I can tell you that our leading, current, and lagging indicators all support the direction that we are taking. Levels of COVID-19 in our wastewater surveillance continue to decline in the majority of areas across our province. From last Friday to yesterday, the number of active cases of COVID-19 in Alberta fell by nearly 500. And the number of Albertans in hospitals with COVID-19 continue to decrease, so much so that AHS has been able to reduce the extra surge ICU bed capacity, getting closer to normal levels. We cannot and indeed must not continue to live in an emergency state. It is not good for anyone to live in a sustained state of stress and strain. Of course, this does not mean that COVID-19 is still not a concern in Alberta. We will continue to monitor the impact of the virus and any other variants that make their way into our province. We will have to adjust to assessing risks and making decisions that are best for us and our families. And I would like to remind Albertans that mandatory isolation requirements are still in place. Staying home while unwell is an important way you can support our ability to manage COVID without extraordinary public health measures. If you're sick or not feeling well, whether it's due to COVID or for some other reason, it just makes sense to stay home and away from others until you feel better. Under the current rules, if you have COVID-19 symptoms or if you test positive for COVID-19, you must isolate at home for 5 days if you have received at least 2 doses of vaccine. If you are either unvaccinated or only have 1 dose of vaccine, you must isolate for 10 days. Another way to keep transmission and the risk of severe illness low as we lift measures is to continue getting every vaccine dose you are eligible for. That's because we know that vaccines are the single most effective way to prevent loss of life, hospitalization, and serious illness from COVID-19. This includes boosters. And I would like to remind Albertans that boosters are easily and readily available across the province by appointment and on a walk-in basis. Boosters still provide protection against severe outcomes. And I continue those who have not yet received one to get one as soon as you can. While we work towards moving into an endemic state, vaccination against COVID-19 continues to be a priority for this government and for all Albertans' well-being. That's why I'd also like to remind Albertans that starting today, we are launching a vaccination effort to help get more kids between the ages of 5 and 11 vaccinated. For 2 weeks, AHX clinics across the province will provide pediatric vaccines for children aged 5 to 11 on a walk-in basis. In addition, over 150 pharmacists with experience giving vaccines to children and extended opening hours are also available to help vaccinate children. And there are several physicians around the province that are also offering vaccinations to their young patients. By extending clinic hours and eliminating the need to book appointments ahead of time, we're hopeful that more families will find it easier to get their kids vaccinated against COVID-19. The list of AHS clinic locations and the hours they're open is up on the AHS website, and the list of pharmacies that can do pediatric vaccinations is available for appointments through the Alberta vaccine booking system. Now, on March 16th, we'll reassess the situation, look at demand, and determine if these expanded services should continue. We have come a long way as a province, despite COVID leaving a tremendous mark on all our lives. I know that many are still feeling the impacts of COVID, whether through grief, personal illness, impacts to our workplace, or our social lives. At the same time, we can be proud of our province and its people. So many of us have done the right thing, took the safest steps we knew to protect our family and friends, and got vaccinated as soon as we could, or as many doses as we could, for close to 2 years now. It is because of these sustained efforts that we can move forward together as a province to a bright and exciting future. So I'd like to thank all of those Albertans who have gone through this challenging times, and also thank all of our healthcare workers who provided services day by day through 5 waves of COVID. But now it appears that we're heading towards the end of the 5th wave and moving to the endemic phase. So with that, thank you, and we'll be happy to take any questions.
Thank you, Minister. We're going to start on the floor here. So for those of you here in person, if you have any questions, please approach the mic, identify your name, your outlet, and who your question is to.
Wonderful. Shailan Skolsky, CTV News Edmonton. My question for the Premier and the Health Minister, if he has any comment as well. I'm just asking about the decision to amend the Municipal Government Act to take away the city's powers. I guess if you just have more of an explanation as to why you're doing it, how much consultation with cities you had, and what do you make of a criticism that this is taking away cities' powers?
Well, public health is the responsibility of the provinces. It's not a municipal responsibility. Secondly, we have shown flexibility for municipalities that at various times through COVID brought in their own measures, and we wanted to demonstrate that flexibility. But now that we're moving out of this, we think it's really important that we do so united, not divided, with clarity and not confusion. We're concerned that if we have a patchwork of different policies across the province, it will create unnecessary division and confusion amongst the public. One critical thing for public health measures to be effective is that they be as clear as possible and consistent as possible. And we've done that imperfectly, I admit, through COVID, but having municipalities improvise their own policies when it's not really their area of primary responsibility is, I think, unhelpful and divisive. And finally, there is no compelling public health rationale for it. And I am concerned that if municipalities have this power, it will increasingly become a political and not a public health issue, which I think will just generate public cynicism. So we appreciate the care and concern of people in municipal government about these issues, and we're always willing to listen to their views about public health policy. But we think as we go into this phase, getting our lives back to normal, it's important that there be unity and clarity, consistency, and that's what we're bringing in through these amendments.
Do you have a follow-up?
I do, yeah. Just as a follow-up on masking, I guess, can you explain the rationale for removing masking? It provides a level of security for people, limits the spread of COVID. It's minimally invasive. People have gotten used to it. I talked to an infectious disease specialist this morning who says it is the best solution right now until we see lower case numbers. Why remove it?
Well, I would say the best solution is to continue to move up our vaccine rates, particularly for the 3rd shots. In fact, if I'm concerned about anything at all, it's that we are below the Canadian average on the booster shots, and we just encourage people who have got their 2nd shots, which demonstrates that they want vaccine protection, to step up and get that 3rd shot, and that's what we'll continue to make available. As Minister Copping outlined, we are making it more convenient for parents who want their kids to get the benefit of vaccine protection as well. In terms of mask mandates, look, for the government to force people to wear a mask is, I mean, I think we've almost become used to these things as though it's normal. This is an extraordinary intervention in people's lives. It makes a lot of people very uncomfortable. And let me say, as I said earlier, yes, there may be some marginal advantage in reducing viral transmission, but we know that Omicron is so transmissible that it is all around us. And we have to be realistic about that. We also, look, at the end of the day, we've always said that public health restrictions in Alberta will only be there as long as they are absolutely necessary to prevent overloading our hospitals. They should not be there for 1 day longer. The government should not exercise extraordinary powers on people's basic freedoms and their normal life unless there is a very compelling and immediate need to do so, in this case, to protect our hospitals. That is no longer the case. And finally, we see growing non-compliance, and it becomes increasingly difficult for businesses, for example, to enforce something when the risk, both personal and social risk, is so much lower. And as I'm just going to restate a final argument about this, which is that, as I said, we are social beings. We are made to live together, to interact with each other, seeing each other. And this kind of constant kind of interruption in normal social interaction, I don't think is healthy in terms of people's mental health and emotional well-being. We should be at least as concerned about the mental and emotional well-being of people now as we are about COVID, given the declining pressure on our hospitals.
Thank you. We'll move to the next question.
Yes, Sheldon Spackman, RD News Now. It's for the Premier or the Minister, either one. Basically, today is a big step for the province of Alberta, and many Albertans will view this as a very positive step forward. For those in the province that might be a little scared or nervous or apprehensive about this big new step forward, what would you say is your main message to them specifically, whether they're immunocompromised or not? Sure. Maybe just some just feeling a little nervous about this big step here today. What's your main message to them specifically?
Well, the main message is people are free to make their own choices and to do so safely. If people want to wear masks, they're more than free to do so, and we should all respect that choice. If people decide they're going to stay home and not interact socially, again, they can make that choice based on their risk profile. So this is about allowing people to make those choices. But, 90% of adults in this province are fully vaccinated. The disease does not now pose a threat to our healthcare system. And sooner or later, we just got to get our lives back to normal. And the vast majority of Albertans want to move on. And we can do so now safely, carefully, and prudently. So for folks who continue to be concerned, look, if there are people who are very elderly or who are uniquely immunocompromised, yes, they do need to take care. And that's why, for example, we're maintaining the mask requirements in nursing homes and hospitals, of course. But I would just send a broader message that it is not good for individual health or social health to live permanently in a state of fear. And I send this message to those who have been, for 2 years, promoting a constant, nonstop message of fear. Yes, there have been times when we have legitimately been afraid of running out of hospital beds, and where action was necessary. But to promote a constant psychological background noise in our society of an elevated fear for a disease that is now less severe with widespread population protection is irrational, and I think will only accelerate the mental health crisis we see in our society today. Yesterday morning, I was meeting with some folks who work with youth facing mental health challenges in Medicine Hat. And they reported to me a deep crisis of mental health amongst adolescents. We've heard this for much of the past 2 years. And for kids like that, we need to give a message that they can live normally and happily. We can be social with one another. we have to get that level of normalcy back to get the full mental and emotional state of our society back on track, and that's why I think today is so important.
You have a follow-up, Sheldon? All right, we'll move to the next question.
It's Tom from Global. It's for the Premier or the Health Minister. Is your government moving forward on a directive for AHS to remove the vaccine mandate for healthcare workers later this month?
Well, we have given direction to AHS to come to us with options on the vaccine mandate because the data is clear that while vaccines are still powerfully protective against severe outcomes like hospitalization and death, there is now no longer any meaningful statistical difference in terms of transmission and infection between vaccinated and unvaccinated individuals. And that's why we lifted the restriction exemption program 3 weeks ago. Because I think the rationale for proof of vaccination programs no longer exists. The rationale was this, and it was a compelling rationale. Earlier in the pandemic, particularly in the spring, summer, and fall of 2021, we saw vaccines having a very powerful effect at reducing transmission and infection, not just severe outcomes. But that has changed, and our approach to the disease has to change as the disease changes. We can't just be bloody-minded about this when a policy lever that we pulled is no longer useful. So with the waning protection of vaccines that have been taken months ago and the much higher level of transmissibility of Omicron, we now no longer have a statistically significant difference in the chances of transmission between the vaccinated and the unvaccinated. Now, I want to thank the overwhelming majority of our healthcare workers who have stepped up to protect themselves with the vaccination. 99.8% of Alberta physicians have submitted proof of vaccination. I believe that 98.5% of nurses have done the same. But there are some segments of the workforce, particularly some working in continuing care in rural settings, with lower vaccination levels. In some communities, you'll find perhaps 30% of the continuing care staff in nursing homes who have not been vaccinated and so now are having to pay out of pocket for antigen tests twice a week. Sometimes it's difficult to get those tests. Often they're not available in the rural areas that they serve. This is creating unnecessary stress on our healthcare workforce in many parts of the province. So we've asked AHS to come back with options. If the issue is reducing the chance of transmission, then perhaps we should consider a universal workforce requirement for periodic rapid testing. If we did that, I think the government should pay for it, not the healthcare workers out of pocket if it's a work safety requirement. But even there, we know, as Dr. Hinshaw has frequently pointed out, that the rapid antigen tests are not particularly effective, don't have a very high degree of accuracy amongst asymptomatic people. So those are the issues that we will be reviewing. But as I say, we need to address the workforce challenges that we are facing, particularly in nursing homes and some rural hospitals, in under-vaccinated areas, given that there is no longer a compelling policy rationale for proof of vaccination programs.
I want to get you on the testing. You just said the rapid antigen test, it's not overly effective for asymptomatic people. Will we ever see an re-expansion of PCR testing in Alberta? Will we see an expansion back to more groups, or are we done with PCR testing?
So at this point in time, we're not looking at an expansion of the PCR testing. We are maintaining our ability to do PCR testing for high-risk settings and for high-risk individuals. So, hospitals or individuals who actually may be eligible for Paxlovid, for example, in terms of to be able to do confirmation. And actually, in terms of conversations that we're having across the country, directionally, that's where most provinces are going. We're maintaining some capability within our PCR testing in case we need it again, because that's going to be important because we don't know what's going to come at us. But at this point in time, we're not going to expand that back up.
Thank you. We'll move to the phones now. Operator, can you please put through our first caller?
Thank you. David Staples, Edmonton Journal.
Thanks for taking my call.
I'm just trying to figure out why the Municipal Government Act needs to be changed. In the past, when the provinces wanted to bring in mask mandates, for instance, province-wide, you've just done so, and the municipalities must fall in line. Seems like if there's a compelling public health reason in terms of mental health to get rid of these mask mandates province-wide, you could just have that kind of order to get rid of them all. Why change the entire Municipal Government Act to do something that might be able to be done just with one particular specific order?
Okay.
Thanks, David. The legal advice we have is that this is the only way to put an end to the issue. We don't have, as I understand it, we don't have the power to order municipality not to use their very broad bylaw power that's currently found in the Municipal Government Act. But if we amend the Act, then that amendment, the provincial law, overrides the municipal bylaw authority. So this is the legal advice that we've received. The Department of Municipal Affairs is currently drafting these amendments. I hope that they will be introduced as early as next week in the legislature and passed quickly, again, to provide clarity and to avoid division.
David, do you have a follow-up?
Yes, Premier. I'd like to ask you on an unrelated topic about energy security. In the past, we've heard a lot about the need for energy security, particularly after 9/11. It was a North American priority and became one to some extent in Canada as well. In the wake of what's happened in Ukraine and people's questioning now the use, buying of Russian oil products to fund their war machine, what do you think is going to be the impact on North American energy policy, and what might it mean for Alberta?
Well, there must be a fundamental rethink of energy policy across the world and here in North America. What we Albertans have been saying for years is this, that getting pipelines built to sell our responsibly produced energy to the rest of the world is not just in our economic interest, it is in the world's interest in terms of global peace and security. I've always said this is actually a moral cause because many of the world's worst regimes have dominance in global energy markets. We see that it being demonstrated with barrel bombs apparently being dropped on civilians in Ukraine today. As one MP said in Ukraine, every barrel of Russian oil is filled with Ukrainian blood. But that could be said of the barrel bombs dropped on Yemeni citizens by the Saudi military with Saudi oil wealth. That could be said of the barrel bombs dropped on Syrian civilians by the Assad regime, backstopped with Iranian oil wealth. That could be said of many of the world's worst regimes. And it is perverse that we have allowed North American politicians and activists to impair the development and export of North American energy produced in liberal democracies at the highest human rights, labor and environmental standards, increasingly to hand over global energy dominance to madmen like Vladimir Putin. This must end now. And that must begin with a global oil embargo on Russian oil exports. I hope the Biden administration also stops their discussions with Iran to lift sanctions on Iranian exports. I am encouraged to see the Europeans being, frankly, mugged by reality on this, and the Germans now suspending the completion of Nord Stream 2, and they're now talking about continuing with their safe nuclear power production. I think so. What we are seeing, at least from the Europeans, is a newfound realism about the imperative of energy security. Next week, I will be traveling to Houston to speak to CERA Week, which is the largest oil and gas conference in the world, all of the CEOs of the major energy producers. And I will deliver a very blunt message. Normally, an Alberta Premier is supposed to go down there and talk about one issue only, which is carbon emissions. And we'll address that and how we are working with oil sands producers to continuously improve our environmental performance. But how outrageous is it that these companies that have divested from responsibly produced Canadian energy moved, in the name of ESG, moved capital to invest in oil fields like Russia's? I mean, many of the global companies that divested from the oil sands in the past few years have significant footprints for energy exploration and development in Vladimir Putin's autocratic Russian society. They need to be called to task. You know, BlackRock, that wrote that letter 18 months or 14 months ago about ESG, they just bought 50% of a pipeline in partnership with a Saudi state-owned enterprise while that country is bombing civilians in Yemen. It is time for some truth-telling about the cynicism that we have seen in capital markets and in North American politics. I'll be speaking to U.S. Political leaders in advance of my trip to Houston to discuss exactly what you have raised. How can we cooperate with the United States as this issue, I think, dramatically changes the discourse on energy security to advance continental pipelines? And finally, I appreciate measures taken by Prime Minister Trudeau in support of Ukraine, provision of lethal munitions, and sanctions. But the single most powerful thing that Canada could do with the third largest energy reserves in the world is to make it a national cause of some urgency to get LNG exports to both the West and East Coast, to revive the concept of Energy East. I mean, he announced yesterday that an embargo on Russian oil imports, even though apparently that we currently import a fractional amount at the St. John Irving refinery. But what about all of the other conflict oil that's imported to the east coast of Canada? Why do they get a pass? If we could export the 1 million barrels a day of responsibly produced Canadian energy to the Irving refinery, we could completely displace those OPEC plus imports to Canada. So this should completely change the national conversation and the policy framework to make global energy security a central priority of the government of Canada and of the United States.
Thank you, Premier. Operator, can you please put through our next caller?
Kelly Kreiderman, Globe and Mail.
Hi there. I hear what you're saying on energy security right now, Premier, but have you or the Energy Department looked into at all Russian investment or Putin associates investment in Canadian oil companies, service companies, or energy infrastructure? And is that a concern to you?
Kelly, just 1 second. If I could just ask to get my phone, I've got some data relevant to this, I think. So I don't have a comprehensive readout of what Russian interests may directly or indirectly be involved in, thanks very much, in the Canadian energy sector. But Kelly, we did ask the AIMCO management, that's the Alberta Investment Management Corporation, on Friday to report to us on what, if any, investments they may have. And the report I received on the weekend was that they had approximately $159 million of direct and indirect exposure to Russian securities, including roughly $60 million held through so-called emerging markets quantitative strategy. And that would be less than 0.5% of the $168 billion under management by AIMCO. Yesterday, AIMCO CEO Evan Siddell reported that AIMCO is taking measures immediately to liquidate those small Russian holdings that they have, and I appreciate him and AIMCO for that decision. With respect to what may be other Russian investments in Canada as opposed to Alberta investments in Russia, I called from day one for the federal government to freeze questionable Russian assets if there are plutocrats associated with the Putin regime that have assets. I think the government of Canada should use every legal means at its disposal to freeze such assets. The government of Alberta does not have the power to do so, but we'd be happy to cooperate with the federal government as necessary on that.
Kelly, do you have a follow-up?
I do, yes. And Premier, you speak about the need to move past politics and to move past division, but isn't coming down hard on Edmonton, essentially on the mask question and looking to amend municipal legislation, possibly that will take longer than the mask mandate in Edmonton will actually be in place? Isn't that political as well? And won't people view that through the lens of you playing politics with Edmonton's decision to continue with the mask mandate?
No, I don't think so at all, Kelly. We've been very patient and demonstrated great flexibility for different policies from municipalities over the past 2 years. We indicated 3 weeks ago that we were looking at this issue, and as I said then, if municipalities decided that they're going to confuse the public with entirely separate policies, we may move forward with this. So we've given them considerable notice. We appreciate the decisions made by Edmonton and Calgary Council to not impose their own proof of vaccination programs, in the case of Calgary also, to align itself with the province on the mask mandate. But at the end of the day, Kelly, after 2 years of this, I think the broad public rightfully expects consistency and clarity. And this removes the issue from a potential kind of a political virtue signaling exercise by municipal councillors when this is not a matter properly within their jurisdiction. We fully respect provincial jurisdiction, and we'd be happy to listen to municipal concerns about COVID policy for sure. But you can see this is becoming a mess in Edmonton, where they've actually said that they're not going to enforce their own bylaw. This will just force customers who don't like it to go outside the city. It will create, and you know who really pays the price for this? Frontline workers, teenagers in retail shops and waiters and waitresses then have to navigate their way through a policy dispute between the provincial and civic government. That's just not responsible. That's why we're taking this decision.
Thank you. Operator, can you please put through the next caller?
Chris Varco, Calgary Herald.
Hi, Premier. One of my questions was already asked, and maybe I'll just follow up on one of your responses. We got oil today at $105 a barrel for benchmark WTI. But given what the response was over the weekend by the U.S. administration to questions about Keystone XL, do you think that the changing energy security concerns will actually impact North American oil and gas development?
Yes. Obviously, the increase in prices will, if this is sustained, increase investment in upstream exploration and development. But more broadly, I do believe we have been, to coin a phrase, mugged by reality here. And the world is now seeing what Alberta has been saying for years, that we must, as we have been blessed, as a rights-respecting liberal democracy with the third largest energy reserves on the face of the earth, that can be a force for good by allowing us to displace conflict oil from Russia and other dictatorships. So I think that this totally changes the policy context. We already had, in Washington, we already had a situation where a majority of both the Senate and House of Representatives, for example, have supported increased production in North America. I think that is now headed to becoming a supermajority. And so I think this completely changes the policy context. It obviously changes the price context. And let me be clear, I don't relish this. As Minister Tays said at his news conference the other day, he'd rather have $60 or $70 WTI than a conflict in Ukraine, than the invasion of that peaceful country. So we don't... This is not about Alberta cynically taking advantage of this of this gross invasion and political instability. This is Alberta saying that we can be part of a long-term solution. Now, I know some people out there are saying, well, you know, it takes years to get pipelines built and to get major energy productions in production, and that none of that's going to stop the 40-mile-long convoy of Russian tanks headed towards Kiev right now. True. But we also have to play the long game, just like Vladimir Putin has. Putin's invasion of Ukraine did not start a week ago. It started 8 years ago in Crimea and Donbass. For 8 years, he has been planning for this moment. We can certainly get much more of our energy to the rest of the world if we're determined about this in much less than 8 years. If the bad guys are willing to play a long game using energy as their source of wealth, then maybe the good guys should too.
Thank you. Operator, or Chris, do you have a follow-up?
Yeah, I just wanted to ask you about your comments regarding LNG. What specifically do you want the federal government to do with regards to promoting LNG developments off the east and west coast of Canada beyond what is already taking place today?
Well, we clearly need certainty around Coastal GasLink so that LNG Canada gets completed on time, so we don't miss the boat on the next round of contracts for Asian LNG imports. Secondly, we in Alberta, we are working with as you know, consortium called for the Rockies LNG project to see if we can be helpful, and we have raised this with the Government of Canada to collaborate with us on hopefully getting a second major West Coast LNG project to come to a positive final investment decision. And I have to have some frank words about the new policy of the Government of Quebec in this regard. In 2019, 2020, I and my office actually worked with a LNG project proposed for the North Shore of the St. Lawrence, Énergie Saguenay, and actually helped to make connections that had brought Berkshire Hathaway to the table for a prospective $5 billion investment in that project, because we thought ultimately would benefit Western Canadian producers. But in part, I think because of the uncertainty around the winter 2020 protests on Coastal GasLink and the political uncertainty that created, Berkshire Hathaway backed out and Énergie Saguenay. And now the Government of Quebec is saying that it will not permit any or facilitate any LNG, let alone domestic gas consumption. And Justin Trudeau has effectively granted a political veto to the province of Quebec over a prospective interprovincial oil pipeline, such as a revival of the Energy East concept. So we need the federal government to assert its jurisdiction over interprovincial pipelines. And frankly, I call on the Government of Quebec to be part of the solution to reducing European carbon emissions and eliminating Russia's stranglehold on European energy supplies by working with us to export responsibly LNG. I think that if private sector investors could see clear political and policy support, that they would come back to the table for a potential major East Coast LNG project.
Thank you. We have time for 3 more. Operator, can you please put through our next caller?
Thank you, Natasha Reeb, CBC.
Hi, yes, so the question is for Premier Kenney. Yourself and Health Minister both touched on the idea of respect, respecting people's choices to wear masks in public. Yet amending the MGA to take that away from cities and towns seems to be not upholding that idea. How do you respond to that?
Oh, no, we absolutely respect the right of Edmontonians to wear masks and all Albertans to wear masks. This is about policy consistency. And what Edmonton wants to do is not to respect the choice of people not to wear masks. So what we're embracing here is choice and respect for those choices, as opposed to a division for political reasons that will make life even more difficult for businesses that have to enforce these rules.
Natasha, do you have a follow-up?
I do. It is regarding the AHS directive. Did your government direct AHS to lift their vaccination mandate on March 15th?
Again, I'll just refer you back to the answer I gave to that question a few minutes ago, and the answer is that we've asked AHS for options because there is no longer any evidence of any significant reduction in the chances of transmission or infection of unvaccinated people versus vaccinated people. So proof of vaccination policies have lost their compelling policy rationale. We do have ongoing workforce challenges, particularly in rural areas and in nursing homes, where there are sometimes a significant number of unvaccinated workers, and often in areas where it's very difficult to obtain a rapid antigen test, which is the current optional requirement for AHS workers. So given that there's no compelling health rationale for this, and given the strains on the workforce in many parts of the province, we've asked AHS to come back with options for a more consistent policy. Again, I'll say perhaps the option that if they want to propose a rapid test, because vaccinated workers are effectively just as likely to transmit to each other or to patients as unvaccinated workers. So if the issue is preventing potential transmission in a healthcare setting, then perhaps the solution is widespread periodic testing of the entire healthcare workforce. But again, doing that using rapid antigen testing for people who are asymptomatic doesn't make a lot of scientific sense. So anyway, those are the issues. We've asked AHS to come back to us with options, but given that vaccinated healthcare workers are pretty much as likely to transmit as unvaccinated, and we're facing workforce challenges, we think that the current policy is not defensible.
Thank you, Premier. Operator, can you put through our second last caller?
Adam McVicker, Global News.
Morning, Premier. Thanks for taking my question. The mask bylaw in the city of Calgary has ceased to take effect as of last night, but there were some questions yesterday regarding whether city bylaw or transit peace officers would be able to enforce the provincial mask mandate on Calgary Transit. I was wondering if the province has granted any permissions or authority to those to bylaw or peace officers to do that enforcement.
Yeah, I'm afraid that I'm not aware of that, but I'll ask our staff who are monitoring this to get an answer back to you as soon as possible.
And Adam, do you have a follow-up?
Yes, I do. One moment, just pulling that up now. In terms of the restrictions being lifted as of today, I was wondering, what guarantees are there for people that this is going to be it, that this is the last time we're going to be talking about implementing or easing restrictions here in Alberta?
Well, there really are no guarantees in life. I do think we can move forward with confidence based on the level of population protection, the new treatments coming on board, targeted measures for the vulnerable, and knowing the history of similar contagious viral diseases, that this is something we should be able to move into an endemic phase. That has been the decision of governments of different stripes all around the world. And so let's move forward with confidence. I can't say with 100% certainty what the future may throw at us, but I'll come back to this. If COVID were to return with a far more pathogenic, a much more virulent mutation in the future that overcomes widespread vaccine protection, it would be the first time, at least in the last century, in modern scientific history, that we saw this continue on for that length of time. Now, I suppose that's theoretically possible, but as we know from Spanish flu, Hong Kong flu, multiple other SARS and so forth, multiple other contagious respiratory diseases, over time, you increase population immunity. Typically, over time, the mutations become less severe. And so we have two choices here, Adam. We can either say that we are going to spend the rest of our lives in fear, waiting for a much more virulent mutation of COVID-19, Or we can say, with widespread population protection, we are determined to get on with our lives, and that's what Alberta's choosing to do.
Thank you. Operator, can you please put through our final caller?
Radio-Canada.
Oh, hi. This is a question for the Premier. Monsieur Kenney, probablement en anglais et en français. Je pense que ma première question a quand même été largement touchée. Je vais la poser en anglais juste pour le bénéfice de tout le monde. Former mayors Nenshi and Iverson said several times, I think, that you were eager last year to see them adopt their own mandates. What changed? Why was that a good strategy last year, and why is it not a good strategy now?
Well, I wouldn't say I was eager, but we certainly, if they wanted to, we permitted that. And as I said, we've always shown flexibility. But that was in the middle of the pandemic. And we have every reason to believe that we are moving out of this pandemic. And so we need at this stage to have consistency, clarity, and unity rather than confusion and division. Vous voulez en français? Évidemment.
Oui, s'il vous plaît.
OK. Écoutez, on a démontré énormément de flexibilité en ce qui concerne les règles des gouvernements municipaux dans le milieu de la pandémie. Mais aujourd'hui, nous espérons la fin de la pandémie. Et alors, je crois que c'est important d'aller en avant avec un sens de clarité et de l'unité sociale, pas la division et la confusion.
Francois, do you have a follow-up?
Yes. Maybe just to rephrase or precise some of your comments about oil and especially those gas projects. Again, maybe this one can only be in French. What do you feel like the events in Ukraine justify revisiting some of the decisions made by the federal government and Eastern government, especially the Quebec government, about projects like Energy East and those LNG projects in the St. Lawrence?
Je crois que l'invasion de l'Ukraine par Vladimir Poutine démontre ce que l'Alberta a dit depuis des années. Ça veut dire qu'il faut avoir plus de l'énergie produite par les démocraties libéraux comme le Canada pour réduire la dépendance du monde, particulièrement l'Europe, sur le pétrole de conflit, le pétrole de guerre. Parce que chaque baril de pétrole russe, maintenant, fournissent la machine de guerre de Vladimir Poutine. Alors, je crois que l'invasion a changé radicalement le débat et l'urgence de construire l'infrastructure, y compris les oléoducs et les exportations de gaz liquéfié naturel du Canada au reste du monde. C'est la raison pour laquelle la semaine prochaine, je prononcerai un discours à Houston, au Texas, pour un partenariat pour la sécurité nationale de l'Amérique du Nord avec les États-Unis. Et j'exige le gouvernement fédéral et le gouvernement du Québec de travailler avec nous autres et les provinces à côte l'Est pour créer une politique claire pour développer les exportations de l'énergie canadienne. Alors, je crois que c'est une urgence pour la paix et la stabilité globale. I pretty much just said what I did in English, in case somebody's wondering. So, all right, is that it? Thank you very much, everybody. And thank you again to Hash, and looking forward to getting a late breakfast, I think. All right, thank you very much. Cheers.